patients want to talk about this. We have a duty and a responsibility to raise this topic with our patients. Chemotherapy will often affect the mucous membrane. So it's really common for people on some kinds of chemotherapy to get mouth sores. We have mucous membrane in other parts of our body as well. So it's really not unusual for a woman who's having mouth sores to also have a very sore vulva and or vagina. And that can be really difficult to raise. Often it really does bring a couple closer together. You know, there's a saying, honed by fire, right? It makes the steel stronger. So very often there is great personal growth, and you see aspects of your partner that perhaps you've never seen because they did not show that, because there was no need. Communication aspects are really important. I think it's really important to include the partner in discussions around sexual side effects, because the partner may be afraid of causing pain to the individual with cancer. One of the things that cancer does, certainly to a couple, is it will take away the spontaneity, the ease, the reliability, the ability to do something without communicating, without having to use an oral medication or a lubricant for a woman, an oral medication for a man. It requires a negotiation, it requires preparation and planning. Men tend to have a much more robust body issue. Body image is often a huge issue for women. The presence of scars, the absence of a body part, whether they can have children one day. I guess perhaps the only have to, I think, is to be open and recognize that as human beings we have a fundamental need for touch, and that when you deny yourself that touch, right, it erodes at a piece of your soul, and that's a sad thing. There are no right or wrong answers around disclosure of a cancer history. Then there are people who say to me that the first date is too early because it's just a date. The third date is too late, so they tend to disclose on the second date. And I encourage the cancer survivor to actually just let it be, and to allow them to kind of gather their thoughts, and maybe, tomorrow or next week or on the next date there will be more questions, or sometimes they just don't ask any more questions. Sometimes it doesn't make a difference. Loss of sexual desire is a huge issue for women. So one of the things is the difference between reactive and spontaneous desire. Start touching your partner, or yourself for that matter. Often that is when desire happens reactively. We've got things that we can do for vaginal and vulval dryness. We have various moisturizers and lubricants. That tends to be a big issue for women as well, because often the treatment will push women into early menopause or really exacerbate menopausal symptoms. And vaginal and vulval dryness is a common symptom of lack of estrogen. But lubricants really make things fun and a whole lot easier, I think, for women across the lifespan. It's not just when you've had cancer. I explain the difference between a moisturizer, which is for daily comfort, versus a lubricant, which is for sexual activity alone with a vibrator. I talk about how a vibrator can really be your friend, particularly for women. As we get older, we need more direct and more intense stimulation, and a vibrator can really be helpful to one's partner, so they don't get exhausted.